Okay, I don't want to take up too much of your time because I know we have 7 minutes with you here. So if you just want to start off, I know you work for the White House, so kind of describe your job and your role on the White House Coronavirus Task Force.
Sure. So my current role, I'm the Senior Policy Advisor for Equity on the White House COVID-19 response team. And the response team as a whole, we're looking at the entire effort aimed to help our nation and even the world navigate this pandemic and make sure that we're keeping people safe. And just as important as it's been to get vaccines to people, to get testing and therapeutics to people, equity has been such a critical part of this as well, making sure that all communities have the resources that they need. And so that's what my role is. It's really making sure that we're keeping an eye on how different populations, different geographies are differentially affected by this pandemic, and try to find ways to navigate some of those challenges to make sure that everybody has a chance to make it through this as well as possible.
And talk to me about what is going on right now at the White House and conversations about this new Delta variant. We know it is surging in the neighboring state of Missouri right by us. And then now in Kansas, we're also seeing more Delta variant cases pop up. I know just yesterday we had more than 1,100 in the state of Kansas. So what advice and what is happening, I guess, from the White House level, and what advice do you have for those of us here in Kansas?
Well, we've been watching this variant for some time. We saw it in India causing lots of problems. We saw it in the UK pretty quickly become the dominant variant. And then here in the United States, as you may have heard the CDC director, Dr. Walensky, say just the other day, it's at about 83% of our new cases are the Delta variant. And that's cause for concern for a few reasons. This is a variant that seems to spread faster, which has allowed it to become the dominant strain. That means it's spreading between people faster, especially at a time when a lot of folks are out and about, and we want to make sure that we're getting things under control. But the other thing is that the early indicators are that it's leading to more hospitalization. So some folks are getting a little bit sicker with this Delta variant as well. So we want to keep an eye on our resources in terms of our hospitals and that capacity, and make sure that people aren't getting really sick. And so it definitely has our full attention. The good news, of course, is that the vaccines are still effective against it, but you've got to get vaccinated 5 weeks before you come in contact with the virus for it to help you out. And so we're really trying to get as many people vaccinated as possible. Our conversations from the White House are really about how do we make sure that we keep the nation protected in the midst of this new challenge, this new dynamic with the Delta variant, and we're doing everything we can to do so.
And for the Kansans, Dr. Webb, who maybe are still vaccine hesitant, they don't trust the science, they think it's too soon, there's too many unknowns, what would you tell them to convince them otherwise?
Well, I think there's a tremendous amount of data now that talks about, not just the timeline under which the vaccines were developed, because I think too soon, most folks who've heard the real history of the development of these vaccines, they know that it's not something that was developed overnight. And when people have concerns or questions about the safety and efficacy, at this point, we've got over 160 million Americans who've been vaccinated. We've got a tremendous number of folks where we've seen that they've been able to be safely vaccinated. That's protected them from the need for hospitalization, protected them from death from this virus. And so I think the experience that America has with this vaccine puts us in a different moment. You heard more people saying things like that in January, February, but now that we're in July, we know that there's a lot more information. So I think the key is just listening to people's questions, making sure that you're responding with facts and telling them, here's what we know and here's what we don't know, and then also directing them to people that they trust, because just hearing somebody who they've never met before telling them something about the vaccines may not be the right approach, but making sure they're talking to their own health professionals or public health professionals in their community to get a better sense of, is this something that's right for them? That's going to be one of the keys. But this isn't the kind of really fast overnight work. It takes some time, and so that's why we're working 24/7 to get people connected to the information they need.
Yeah, it seems like it's kind of, I think Dr. Walensky, like you mentioned from the CDC, she mentioned earlier this week, it's like the war against the unvaccinated right now. It's just trying to get everyone to get that vaccine. And I even know earlier this week, the state health department in Kansas, they actually talked about perhaps bringing back some type of mask mandate statewide. Now in Kansas, it's kind of an interesting situation that the state can say that they want a mask mandatory statewide, but it's up to each individual local county to decide whether or not they're going to adopt that mask mandate. So heading into this school year and knowing that we have kind of this surge in COVID cases happening yet again in Kansas, do you think it's almost crucial to have a mask mandate brought back and have these local counties adopt it once again?
Well, I think I start with the science, and I just say, what do we know about the value of wearing masks? And the science tells us for vaccinated individuals, they get pretty good protection from the vaccine itself. For individuals who are unvaccinated, it's really important that they take extra precautions like mask wearing, like physical distancing, like hand washing, and like avoiding crowds. And so when you put those together, I think that at the local level, people are able to make really good decisions based on the current rate of vaccinations and the current rate of cases, and essentially construct a notion of level of risk in our community. You know, I live in a county in Virginia that has almost 80% of folks who've had at least their first shot. That's where I live. And so the risk profile in my county is going to be very different than the county where my wife grew up, about an hour and a half away, where about 49% of people have had a first shot. And so I think it's really a matter of getting local with it and saying, what is it that we're seeing here in our area, and what's the role of masks for us locally? And I think that's going to be really the key. But no matter what, we know the ongoing utility of talking about folks being vaccinated. We know the ongoing utility of making sure we're pushing that forward. And if folks aren't vaccinated, really driving home that CDC guidance that says if you're not vaccinated, masking, physical distancing, hand washing, and avoiding crowded spaces are the key to your staying safe through this pandemic, especially as we're seeing cases increase.
Very good. And one last question I have for you, because I know our time is almost up here, is do you have any insight into when children under the age of 12 may be eligible to get the vaccine?
Well, you know, as somebody with 2 children under the age of 12 myself, I'm eager for that information. If I had, you know, a clear sense of exactly when that's going to be the case, believe me, I would be singing it to the hilltops. But for now, we don't know exactly when. We know that that's currently under investigation. And as soon as we know that it's safe and it's effective, and that's something that I appreciate. As a parent, when I'm thinking about my kids being vaccinated, when I think about the risk of COVID-19 to my kids, I understand that risk and I try to keep them as protected as possible. When it comes to the vaccine, I want to make sure that we understand the potential risk and I'm keeping them as protected as possible. So I don't want to see the recommendation before we have good science behind it, the same way we did for folks over the age of 12. And so I'll be waiting with bated breath. And I know as soon as it's available, again, as soon as the data is there and it's as safe and as effective as it was for my wife and I, we're going to make sure to get our kids vaccinated too.
All right. Well, thank you again, Dr. Cameron Webb. I don't want to, like I said, eat up too much of your time. We really appreciate you talking to us, and you're welcome to chat with us anytime. Just let us know.
Absolutely. Well, you take care.
Thank you, you too.